Hey, it's Mr. Shrum, and I am back with the anatomy lesson walkthrough, and we left off with the circulatory system at the principal arteries of the body. So let's get into that. Arteries carry blood from the heart to the body, and the major systemic artery is the aorta, which connects directly to the heart. Most principal arteries are a pair, one that serves your left side and the other serves your right side. Here we get a diagram. The ascending aorta derives from the left ventricle of the heart. It branches to the right and left coronary arteries, which serve the heart. So there's the arch and the ascending portion. And we have three vessels that derive from that arch. We have the left common carotid artery, the left subclavian artery, and the brachiocephalic trunk. You see each of those here. And the left common carotid artery branches from the aortic arch and delivers blood to the left side of the neck and head, while the left subclavian artery branches from the arch and delivers blood to the left arm. So we have the carotid artery for the neck and head. The left subclavian goes to your left arm. And the brachiocephalic trunk splits into two vessels. One, the right common carotid artery, transports blood to the right side of the neck and head, and the right subclavian artery, which transports blood to the right arm. You see those here branching off. Principal arteries of the brain, neck, and head. Those include common carotid arteries, internal carotid arteries, external carotid arteries, vertebral arteries. The left and right common carotid arteries move upward along the side of the trachea. Then the common carotid branches into the internal and external carotid arteries. And you can easily feel your pulse near this bifurcation. Bifurcation, bi means two. Also near here is the carotid sinus. And that sinus contains baroreceptors. Baro, as in barometer, that deals with pressure. So receptors, they are like pressure sensors, monitoring your blood pressure. And when stimulated, it results in heart rate decreases, blood vessels dilate, which is known as vasodilation. So it's like when your pupil gets big, we say that's a dilated pupil. So that is a dilated blood vessel. So heart rate goes down, blood pressure goes down, and your blood vessels dilate. The internal carotid arteries enter the base of the skull, and then several branches of the internal carotid serve the brain. The external carotid arteries continue up along the head and neck. Then several branches of the external carotid serve the head, face, and neck. The vertebral arteries arise from the subclavian arteries. They pass through the cervical vertebrae and continue upward. Then when they reach the pons portion of your brain, if you remember from our brain section, so once they reach the pons portion, they unite to form the basilar artery, which serves the brain. as you can see here. Arteries of the upper extremity. So arteries of the upper extremity dealing with your arms and shoulders. We have the subclavian arteries, axillary arteries, brachial arteries, radial arteries, ulnar arteries. And that right subclavian artery arises from the brachiocephalic trunk. So if you look at this trunk, you see the right subclavian artery coming right out of it. And that left subclavian artery does the exact same, but from the arch itself. Oop, let me turn down that sound. There we go. And the subclavian arteries then pass laterally, laterally means to the side, beneath the clavicle, transporting blood towards the arm. The subclavian arteries become the axillary arteries here once they pass through the armpit or the axillary region. So axillary, think armpit. And then the brachial arteries, the axillary arteries become brachial arteries once they pass this brachial region. Brachial, think of your arm near your bicep, brachial. And this is found on the medial side of the humerus. This artery is often used to determine blood pressure. So if you've ever been to the doctor's office and had them wrap a blood pressure test around your arm, that is how they find out your blood pressure. And it's usually higher because people get a little nervous at the doctor. Fun fact. The brachial arteries continue inferiorly toward the forearm and wrist. At the elbow joint here, the brachial arteries branch into the radial and the ulnar artery. So it's all one until we hit that elbow joint and then it splits up. And the radial artery passes along the lateral side of the forearm. You can feel your pulse using this artery near your wrist. So this is why these are all areas where you can feel your pulse, your neck, your wrist, and then you can take your blood pressure here. The ulnar artery passes along the medial side of the forearm. Right there. Arteries of the abdomen. Arteries that serve the abdomen arise from the abdominal aorta, and that's right there. And that is the segment of the aorta between the diaphragm and the fourth lumbar vertebrae. So, right about there. The arteries of the abdomen that branch off this abdominal aorta include inferior phrenic arteries, celiac arteries, superior mesenteric artery, renal arteries, gonadal arteries, inferior mesenteric artery. So looking at each of those, we have the inferior phrenic arteries. Those are small arteries that serve the diaphragm. So think of diaphragm, phrenic, that's where those are. The celiac arteries are short and thick arteries that immediately branch into three. The splenic, it serves the spleen and pancreas. Left gastric, think of stomach. Hepatic artery, that is the liver. So spleen, gastric, think of stomach acid, gastric. Hepatic, think of If you've ever heard of hepatitis, that's where that root word comes from. Or that's a similar use of the root word. The superior mesenteric artery is a single blood vessel that supplies blood to the following: the pancreas, the small intestine, except for a segment, the cecum, appendix, ascending colon, transverse colon. The renal arteries serve your kidneys. The gonadal arteries serve blood to the testes or ovaries, depending on whatever, male, female. The inferior mesenteric artery is the last major branch of the abdominal aorta. This single vessel serves blood to descending colon, sigmoid colon, and the rectum. Yeah. Arteries of the pelvis and lower extremity, so pelvis and your leg, thigh, leg, pelvis region. We have the right and left common iliac arteries, internal and external iliac arteries, femoral arteries, and popliteal arteries, anterior tibial arteries, posterior tibial arteries, and dorsal pedal arteries. The abdominal aorta ends at the fourth lumbar vertebrae, and this is where it bifurcates. Bi means it divides into two. Think of two splitting up. And they split up into the right and left common iliac arteries. And those arteries transport blood down each of your legs. The common iliac arteries divide into the internal and external iliac arteries in the pelvic cavity. So here we go. So the internal iliac arteries branch several times to serve blood to the gluteal muscles, your butt muscles, and the pelvic organs. While the external iliac arteries continue downward and become the femoral arteries. Like that. And the femoral arteries pass an area called the femoral triangle. That triangle is formed by the inguinal ligament, adductus longus, and the sartorius. And this femoral triangle allows easy access to the arteries and veins. You can also feel your pulse here, take arterial blood gases samples, and it is also a pressure point that can be used to control bleeding. So it's a pretty important artery. Several vessels arise from the femoral arteries and serve the thigh region. And one of them being the popliteal arteries as they pass the posterior side of the knee. So right here, they become the popliteal artery. And further down, and further down we have the anterior tibial arteries. And those arteries serve blood to the anterior portion of the lower leg, so the front part of your lower leg. And it transports blood to the foot as well. Those anterior tibial arteries become the dorsal pedal artery, so your foot artery. And that goes to the top of your foot. So you can see all those. Now, there is also the posterior tibial arteries. That serves blood to the posterior portion of the lower leg, so the back side of your lower leg, and the underside of your foot sole. And in conclusion, all of the muscles and organs in your body need blood to function. Arteries carry oxygenated blood to the body. Principal arteries carry blood to your brain, neck, and head, your upper extremities, like your arms, abdomen, pelvis, and your legs. All right. That's the end of the principal artery section of the body. And I will talk to you next time about the principal arteries in the other lesson. But until then, have a great rest of your day, and I will upload these soon. So stay tuned. All right. See you all later. Bye-bye.